Today we had a pretty challenging case ahead of us. What would appear as a very simple, straightforward process of getting an implant placed on the lower left first molar turns out to be quite a difficult implant placement, and it's because of the patient's considerations with their medical history. It's important that a doctor or physician or dentist, their team, comes together to have the patient primed and ready to go for implant placement, because certain medications can make it very difficult to have long-term success. So this particular patient had a history of a medication called Prolia, which affects their bone density and health and can affect the healing of any type of procedure we do. So in this particular patient's case, we had to extract or remove an infected tooth, and the plan was to replace it. After grafting or adding bone to the area, it was apparent that the patient was not healing like we had expected them to. The patient's outcome is still going to be phenomenal, but it's important that whoever's placing your implants understands the complexities of the medical history behind the patient, because that does affect the long-term success.